don't have anyone else on. Oh, Gardner.
Hi.
Hello, Gardner.
Yes.
I can hear Gardner.
Yeah. She's not here yet.
All right, thank you.
You're welcome.
And then I heard I saw someone else connect with an 827 number. So whoever connected with just a phone number would be great if when I call on your name and you are online, I would really appreciate you telling me you're here. How was your daughter's birthday party?
Oh, it was great. Great.
I forgot to ask you that last week.
Oh, no.
Yeah, it seems like a week it was a long time.
It did. I know. I was thinking back to it. Wow. It feels like it was.
Yeah. But. So we're going to just wait a few more minutes just to see how many other people join. I know that we had connection issues, and I'm just feeling a little under the weather tonight, so I might be a little more hoarse, so just bear with me.
Oh, is there a limit for how many times we can have those tests reset for us?
I'd really like to do it no more than once,
Okay.
honestly.
Okay. No. I figured. I don't.
Otherwise, I would have set them up so that they were
You could do it.
three. But see, what I do before I reset them is I look at what you had problems with.
Yep.
So I can get an idea.
Well, 18 I had the most problems with. I don't know why.
But mostly it's true and false.
Yeah.
And true and false are always the hardest.
Yeah, I think so. No, I
They're
believe
always the hardest. And I made the 4D specifically true and false just for that reason, because it's billing.
Yeah.
And billing is going to be more about knowing the steps and the procedures and how to do things rather than being on the national exam.
Right.
So they're not going to be on the national exam.
I did great on most of them except for 18. 18 was so hard. I did awful.
And which chapter was that again? Remember?
Oh, it's the seeking employment.
Okay.
I don't know why, because it was about I must be reading the questions wrong, and then I get frustrated, and
Yeah, I don't even worry about it. Just take the grade.
It's bad. All my grades are so nice, pretty much for the most part, than that one. Awful.
Yeah, just take the grade.
All right.
Because I think it's more important how we went over things in class.
Yeah.
You know, this is how you go into an office, this is how things are done, and get me your resume.
Right, I know. You gotta get it.
Because I've talked to that office I told you about. So I'd like to get you in there after the new year, even if it's a few hours at a time. Because you're still working your full-time job, right?
It's only part-time. I'm out of work at 2:30 at the very latest, Monday through Friday, and that's it.
Okay.
And then school this night, and other than that, it's home working.
Okay, good. Now you have your CBT book.
Yes,
Pull that
I do.
out. We're gonna read that.
This isn't the one that you're talking about, was it?
That's it.
This is it?
Sorry, that's the ICD-9 book, yeah.
I was thinking my CPT, because that's the spiral bound one, isn't it?
Yeah.
And I have that one. That's the only other book that I have. So there's one that I still don't have. And I can
It's the
never
head
remember.
picks.
Yes, that's the only one that I don't have.
care if I put tabs on here?
Not at all.
Robert, I am proud of you.
I know. That's what I just told him.
I'm very proud of you. In the beginning, I thought, oh, good.
Well, like I told him, get it, it's behind you now, it's over.
I'm gonna go ahead and get started, because this is being recorded.
So, and next semester, you know, algebra two. Then there's the career.
Do you want a copy of this stuff? Well, that's what I gave you, didn't I?
All right, so welcome to, I believe it's week 7 this week, right? Week 7 of coding. And week 7 of coding is chapter 8. And week 7 is that, right? Week 7. chapter 8, and then I decided because chapter 8 is so short, we're going to go ahead and do chapter 2 tonight as well. Chapter 2 is going to be really brief. So coding, week 7, chapter 8, and chapter 2. Chapter 8 is all about the overview of ICD-9. So you're going to open up your workbooks and turn them to page 199 in your textbook. And we will do our workbook afterwards. And for your ICD-9 book itself, you might have this gray one here, or you might have one that looks like this, and you might have one that looks like this, but it's not spiral down. So I still don't have my 2015 book. This is what your 2015 book should look like. If you have the small one, if you have the big one, it's going to say right on it, 2015. So you'll notice I just put a few tabs in there. We'll talk about those as we go through. I'm going to talk about tabs and tabbing. I will talk about tabbing throughout the class. But you can get these types of tabs, staples. See this right here. This is the numbers, okay? And these are staple brands. These are the alphabet. And then we have just some simple Post-it notes that look like this. And these are the sturdy ones. They're really durable. And you can write on them with a marker. And I also found these that are called Ready Tag. They're Ready Tag. These are the alphabet. And these are the numbers. 1 through 10, and then 10 through 20. And as I said, these are just the Post-it ones, and I like them because they're sturdy. They'll work.
Huh, mine's not coming up for a picture either. Are they having a problem with the system?
Picture Angel. You want to, let's see. Picture.
They've been having with it.
Eddie's Leonard.
Hi.
Welcome.
You got me now?
Yes. I was just talking about tabs and tabbing. Can you hear me okay?
Yeah.
Good. I'm a little under the weather, so I don't want to have to yell, okay? If you can't hear me, let me know. So I was talking about tabs earlier and tabbing, and this is being recorded, so you can always watch the first 10 minutes of the lecture. But basically, these first set of tabs that I held up are Staples brand or Avery brand, and they are alphabet or numbers. And then we have the Post-it ones that are colored, and they're pretty sturdy. You can find them in little tabs like this, or they make them longer. You can write on these for numbers, and you can also write, get the longer ones and write titles. And then some tabs that I just found through WB Mason, and you might be able to even go online and Google them and get them maybe through Amazon. These are ready tags or index tabs, and they have these also in alphabet and numbers for when you're tabbing your book. So I also mentioned that you might have an ICD-9 book like this that says 2015, and it might be spiral bound or it might not be. You might also have a gray one that is ICD-9 CM. And let me just take yours again for a minute, Emily. It might look like this.
Yeah, I have that one.
Okay, so I still don't have mine. So I'm going to be working out of this one. So you'll have to try and follow along. Lisa, it looks like you have the same one as I do. Okay. Yeah, just shake your head, that's fine. So we're going to get started on page 199 in your Buck book, and we are on week 7. And tonight we're going to cover chapters 8 and chapter 2 in the Buck book. I know on the syllabus it only said chapter 8, but because these 2 chapters are pretty short, we can cover them both tonight and get them out of the way. And then you can just go home and do the assignment afterwards. So Angel, did you break the camera?
No, they had a chickadee that had like hit a transformer, and they had no internet on Tuesday when I come in for medical terminology, and then they was having issues again. And then I called yesterday. I'm like, what is going on? I hope they have it up tomorrow. And they said, well, we're hoping.
Oh goodness, okay, no problem. Okay, so let's get started with chapter 8. This is an overview of ICD-9. Now, when we were talking in the Fordney class, we were talking about the Fordney book being the foundation for billing. And when you're billing, you really need to understand all of the ins and outs of filling in a claim form, what the insurances will pay, and so now what we're getting into, as we talked about in chapter 1, was HIPAA and reimbursement. Excuse me. So now we're getting into tonight an overview of ICD-9. So we'll talk a little bit about what is ICD-9. ICD-9 is the International Classification of Diseases. It is this particular stands for 9th revision, and CM stands for clinical modification. Now, if you take a moment and turn to the page in your ICD-9 book that starts with guidelines, you'll see there I tabbed yours. Okay. It should be for the spiral bound book, probably page 1 in the red section, introduction, part 1. And you'll notice right there in the first page, it tells you International Classification of Diseases, 9th revision, clinical modification, CM. That is definitely something I would highlight or underline. Now you'll hear me talk about throughout the class highlighting things in your book. So you want to have some highlighters, pencils, colored pencils, colored pens, whatever you want to do, okay? I didn't bring all my highlighters tonight, but you can get every color in the rainbow, however you want to do it. Some people just simply do a yellow highlighter and a pencil, or, you know, a red pen, or whatever you want. You want this information to stand out for you when you're looking up your codes. Now you're probably wondering, why do you do it for the guidelines? Because there will be stuff on your national exam that you might need to remember is in your guidelines. Okay, so if we highlight it, if we tab it, then we will know where to find it. Remember, coding is not about memorizing, it is about to find that information. So, the ICD-9 has a classification system, and that is the morbidity and the mortality. Your morbidity is the illness, and your mortality is death. So we code death as well as illness. We code the causes of death. As I just mentioned, ICD stands for International Classification of Diseases. And then we go to WHO, WHO. We talked about WHO in the Fordney book. WHO is the World Health Organization. And ICD-9 is used globally, but believe it or not, the United States is one of the last countries to be using ICD-9. All of the others have already started using ICD-10, and there's talk about ICD-11 already coming into place. But we need to get through ICD-9 first. And anyone thinking, well, why can't we just do ICD-10? Because ICD-9 is the foundation. You need to learn ICD-9 before you even consider ICD-10. And ICD-10 is a much shorter course. And if you decide to go through that afterwards, then I would be your instructor as well. So let's get through ICD-9 first and then see how much you like it. With ICD-9, what this also allows us to do is have a continuity of data. Okay? So in 1977, the US developed the ICD-9-CM version. There are more code subsets that define medical care. The ICD-9-CM data is comparable to the global data of the ICD-9. The ICD-9 is updated annually October 1st each year. That is why when we have classes at this particular time, it takes so long for us to get our books, because the publisher is basically scrambling to get any changes and revisions into the publication and get it to press and print it and bind it and get it shipped out. That is why it takes so long. When you have these new codes every year, the new codes are effective as of October 1. Now, there might be some grace periods along the way, and you will know that because a newsletter or something will come out that says, effective April 1st or October 31st or March 31st. We also have updates to the ICD-9 April 1st. In the April 1st update, actually there isn't a grace period. When they update April 1st, it starts April 1st. And how are you going to know that these are taking place? They will send out alerts, they will send out newsletters. So it's important to get on what I call e-subscribe or e-newsletters and get the updates. Medicare. The Medicare Catastrophic Coverage Act of 1988. We're still on page 199 in your textbook. The Medicare Catastrophic Coverage Act. This was in 1988. It required the use of ICD-9 codes for diagnosing. The act was later repealed, but the codes are still used. In 2003, it became effective that all claims must have a valid diagnosis, except ambulance suppliers. Your ambulance suppliers are exempt from having a valid diagnosis. Because honestly, the reason that they pick up the patient might not always be the reason that they get admitted or seen at the hospital, okay? So when they go and pick up a patient or respond to a call, they're responding based on the initial signs and symptoms. So they don't have to have a valid diagnosis, just what is going on with the patient. So you will see that the uses of ICD-9 are for facilities to track information by using these codes. And then your fiscal entities track healthcare costs based on the diagnoses that are used. Your ICD-9 codes also help with research, healthcare quality, and then future needs. So you might see, based on the news, okay, that there's been an outbreak of swine flu. Well, how would we know that? Obviously, there's a lot going on in one area. How about people with cancer? Okay, so research actually helps predict our healthcare trends, and it helps to get an idea of the increasing needs of patients. In 2010, there was actually a jump in cancer for patients that were in a particular area of the United States. So based on that need, they actually built cancer centers. Okay, so that's how diagnosis codes can help with research. And as I just mentioned, newscasters reference a number of things in the news that we see every day. So you're going to see results every day in the news of certain things that might happen. It might be measles, it might be vaccinations, it might be a reference to a number of AIDS cases, or whatever else might come along, okay? But pay attention to it because it's out there. Some principles and practices. There are actually 4 groups together that maintain the ICD-9-CM. And you should not only see that in your textbook, but you should also see it right there in your guidelines on that first page. It is the Centers for Medicare and Medicaid Services, known as CMS. They were formerly known as Healthcare Financing Administration, also known as HCFA, HCFA. Right, underneath the Coordination and Maintenance Committee. Okay, then you also have the National Center for Health Statistics, that is NCHS, American Health Information Management Association, also known as AHIMA, and American Hospital Association, AHA. Those should all be right there in your guidelines. Let's talk about the AAPC Code of Ethics on page 200 in your text for a moment. When you're coding, your coding should be performed as consistently and as accurately as possible. So the AAPC actually has a code of ethics. So when you sit for your national exam and you pass and become a certified professional coder, this is the standard code of ethics that you're basically signing up for. So if you haven't read it, please read it. Basically, we are held responsible and liable for the work that we perform in the practices. ICD-9, documenting medical necessity. Well, documenting medical necessity means that the diagnosis establishes the medical necessity. Your services and your diagnoses must correlate. When you have the correct diagnosis codes, this allows for accurate reimbursement, fewer rejected claims, and a reduced risk of sanctions and fines from an audit. Now, I know in the back of your book there are parentheses for EHR screen captures. And if you look, where is it?
$908.
That's one of them. Yep, page 908 is one of them. How about 913, page 913, where we're talking about charge capture. You'll see there on the page, it gives you the dates of service, the recent diagnosis codes, it gives you the procedure codes, and the dates of service. That's pretty much how you would be entering your information into an EHR. All right, on page 202 in your textbook, and we have seen these in our Ford Me book, is the CMS 1500 health claim form. Now, we didn't go over that box by box by box, correct?
Right.
We will be going over that in the future. We will be doing an actual claim form. So, we talked a little bit about our code of ethics. Okay, make sure also that your documentation supports the diagnosis. So I came in for a little back pain, but you wrote down that I sprained my ankle. Now I might have sprained my ankle because of my low back pain, or I might have caused the sprained ankle because the low back pain, because I was walking right. But if I have low back pain, you should have in the notes somewhere low back pain, not just that I have a sprained ankle. Because you're going to give me a sprained ankle diagnosis and a low back pain diagnosis, but if there's nothing in the notes that says she has low back pain, then your documentation does not support your diagnosis. So if a service is provided, the diagnosis should justify the service. When you are in doubt, ask. Do not make assumptions. So what is our job as a coder? It is to translate the documentation into ICD-9 codes. So, Legionnaire's disease. Legionnaire's disease, we would look up in our alphabetic index and find Legionnaire's disease, don't do it now, that it's 482.84. When we're coding, we want to code to the highest level of specificity or the highest level of detail. There will always be one code that is the more appropriate code because it is that higher level of detail. And again, make sure your medical record substantiates the diagnosis code assignment. So now we're going to get into the nitty-gritty of the format of your ICD-9 book. Now, it looks like whether or not you have the small gray book that I showed you earlier or the spiral bound book, you probably have 1 to 3 volumes. Volume 1 is the disease section. It is the tabular list where you will find all your diagnosis codes. It has about 17 chapters, all right? So take just a moment and locate volume 1 in your ICD-9 book. And then what page is yours on, Emily?
153.
Okay, so 153 in the gray book. And how about you, Lisa?
669?
Actually, 669 looks like it's, yep, perfect, volume 1. It should say it across the top or across the side. I'm not sure which book you're looking at, but it will say Diseases, Tabular List, Volume 1, right? Yep, okay. So, then, Volume 2 is Diseases and the Alphabetic Index. It's the alphabetic index to diseases and injuries. This is where you'll find diagnoses. Now, this is where the tabs come in, all right? So Lisa Leonard, for our book, it probably starts on page 85,
Yes.
okay? So, this is what I did. Now, for the grade book, you really shouldn't have to do it, but I did on yours, Emily, because it's going to help those sections stick out for you.
Yeah, I want them to stick out.
So if you want, you can just label those afterwards, and I'll show them online what I'm talking about. So let's see here. All right, so this is what I'm talking about. Hopefully you can see. Is that a clear enough picture?
Yes.
Okay, so you'll see the first part of my book is all alphabet, because that is volume 2. Volume 2 is the alphabetic index. So what I did, as you can see, is I charged each section with the letter. So you see my tabs? They all are the alphabet. Now, volume 1 is my tabular. So volume 1, say volume 1. Volume 1 is all of the sections of the tabular. So it starts over here, I think, with 001 to 139. And then it goes 140 to 239. So what I did was those little sturdy tabs that we talked about, I wrote right on here the section of the numbers section, okay? Because 001 through 139 is my infectious and parasitic diseases. And we will get into that as we go through, okay? But just so you know, why why I tabbed it like that. Now, as I said in the beginning, you don't have to tab your books at all. You will see as you start to do homework why it might be helpful to tab them, okay?
Do you tab your new books every year?
I do.
Okay.
I do. Okay, so then across the top, you can see that I have neoplasms, E-codes, drugs and chemicals, and hypertension. Now, this is going to be user-friendly for you. Okay, remember that. User-friendly for you. This is a general start for me. I have students who have done it even more involved than this, and that's fine. You want to be able to go to that section quickly because you're looking up numbers, okay? You're looking up numbers. So when the alphabetic index tells you to go to 280, you want to be able to look at your tab for 280 and flip to it real quick. Okay? You don't want to have to be sitting here like this, going through the pages. Make sense?
Yep.
Correct. And I have my guidelines. I have a separate tab specifically for the guidelines. It says guidelines. Because you're going to want to know where your guidelines start. And you might even want to tab different sections of the guidelines as far as maybe pregnancy. But we'll get into that as we move along. Okay? I just wanted to show you for right now, this is how I use those tabs. Okay? Alphabet, numbers. And what I did for you was just the major sections right here.
Yeah.
Okay? So if you don't mind, let me just pick your picture. So if you have this book, okay, what I did for Emily was I just put the sturdy tabs, and even though they already have little indents, what this does is it makes them stick out more. So I have her V codes and her E codes, volume 1, volume 2. Okay, because to see these, you kind of have to hold the book a little different. And if you notice, when you have the book like this, you can't really see the cutouts. But if you put a tab on those cutouts, that's going to help you find it quicker. Okay? And then just label them. So yours are just very specific. They say 100s, 500, 600. Okay? And you might want to break it down to the 001, 2, whatever. You can decide.
Yeah.
When you get to the doing the homework. Okay, so does that all make sense for everyone?
Yep.
Yes.
Okay. And then there's a volume 3, which we probably will not use. It is procedures. Volume 3 is used more in a hospital setting. So, let's go over each section now. So, volume 1 is your tabular list. And we're on page 201 in your textbook. So, volume 1 is where you will find the diseases, and it will contain code numbers. And it starts out with 001.0 through 999.9. So remember I told you that very first tab in volume 1, okay, it's 001 to 139. And that is because the very first section in the tabular is chapter 1, infectious and parasitic diseases. Okay? So, if you look at your table of contents in the front of your ICD-9 book, you'll see that they list the 17 chapters. And the first chapter is the infectious and parasitic diseases. We also have supplemental information, and that would be the V codes and the E codes. Now, I have those tabbed all by themselves with a tab for V code and E code. And Lisa, you'll find that right at the end of your tabular and before your appendices. So your V codes, Lisa, start probably about 99 maybe. No, 1009, 1008, 1009. We're just talking about V codes and E codes.
Yeah.
Okay? Your V codes and E codes are supplemental information. Your E codes are external cause and injury codes. Your V codes are when a patient is using the healthcare system, but not specifically being seen by a physician or having treatment. So let's talk about how the volume 1 is divided. There are divisions. Divisions within the tabular. You're going to have to tell me if you can see this writing on the board. All right, so the first division is the chapter. First division is the chapter. The second is the section. Then we have the category. Then we have the subcategory. And I believe I said we weren't going to go over this in the board meeting book because we were going to touch upon it in the Buck book.
Yes.
Underneath the subcategory, we have the subclassification. And if you look at it, what does it remind you of?
Set of stairs.
Set of stairs, yes. All right. So we have chapter, section, category, subcategory, and subclassification. So how does that pertain to us? Well, let's talk about that. Turn to page 204 in your textbook. And if you look on page 669, or the very first page of your tabular, you will see that we have infectious and parasitic diseases. What is that? That is your chapter, right? So infectious and parasitic diseases is your chapter. Then, what is the section? The section is what is between those two lines. So the section is going to be intestinal infectious diseases. So our chapter is infectious and parasitic. Our section is intestinal infectious diseases. All right? Our category, if you can think of it this way, our category is always going to be 3 digits. So our first category is cholera, because it's 001. Our subcategory will be our 4 digits. So our 4-digit subcategory is 001.0. So we've covered the chapter, the section, the category, and the subcategory. Category is 3 digits. Subcategory is 4. What do you think subclassification is?
5.
5. So it would be anything underneath the 4. So we don't have it under 001, and we don't have it under 002, but guess what? Over there on 003, we have 003.21. That is a subclassification. Not every category will have a subclassification. It usually will have a subcategory, but not always a subclassification. So if you can remember chapter, section, category, subcategory, you're good. Your category is 3, subcategory 4, and subcategory is 5. 3, 4, 5 digits. So far, so good? Okay. Now, I'm probably jumping ahead here, but this is really important. Just on that first page alone, in the chapter, on page 669, infectious and parasitic diseases. You might have what is called item 1-1. You have item 1-1 in your book, Emily? In your
I always
ICD-9
write
book.
what I have on that.
Item 1-1 in the volume 1.
What page is she, Emily, on? Because I have the same book.
Okay, let me take a look. It's going to be volume 1, so let's find your volume 1. All right. All right, right here. So look on page 159, Angel.
Okay. Yep. Thank you.
Yep. So, all right, if you don't mind, let me just use your book for a second. All right. So this, you're gonna have to bear with me because the gray books are a little different than the other books that we have. All right, so on 159, Angel, and then
Yeah.
at least 669, you're going to see in the gray ICD-9 book, you have alerts, you have excludes, you have definition, which I love in your book because I don't have definitions in my book. But in my book, I have includes, excludes, and I have colored writing. Okay, so depending on what book, it really doesn't matter. What does matter is that you read before, middle, and end. Keep that always in mind. Read the before, the middle, and the end. So we're in the section of intestinal infectious diseases. and the next line says it excludes. Then it tells us cholera, then it tells us the definition, then it tells us what it's due to or unspecified.
So what would our includes be under then? Like looking at the actual workbook, well, our regular book, the chapter 8
Angel,
doesn't have the.
Angel, in your ICD-9 book, if you kept going down to 003,
Okay. Yeah.
you would see an includes. They just don't have it in
Okay.
the back or highlighted.
In each one. Okay.
Okay, so you want to just read the before, the middle, and the end. You want to read everything,
Include.
okay? You don't want to find a code and say, oh, that's it. Because if we do that, we're not coding to the highest level of specificity. Okay? So for Lisa and I, in our book, we have a bunch of pink and orange writing. Again, it doesn't matter whether you have the gray book or the book that I have. It's just a matter of reading every section. You can't read the chapter and say, oh, that's it. You've got to go down. Am I in the right section? And then, do I have the right category? And then from there, it will tell you, do you need to use an additional digit? Because when you see the red dot next to a category, 001, it's going to tell you there's a red dot. That red dot means you need additional code. So do you have a red dot, or is your 001 in red?
It's in red.
So if you look down at the legend at the bottom of the page, what does it say?
Add fourth or fifth digit.
Perfect. So in the little gray ICD-9 book, your category will be in red if you need to add a fourth or fifth digit. In my book, it has a red dot or stop sign next to it. And that tells me it needs an additional digit. Okay, so far so good? Okay. Try not to make this too confusing. All right, so volume 1, so far, that's where we're at. Let's move on to volume 2. Okay, volume 2. This is our alphabetic diseases. Okay, so we start page 85 in my book. What about you? In 1005. Okay? Every publisher will have the book published just a little differently. You might see volume 1 in the first part, and you might see it in volume 1 in another book, in the middle, near the back in another book. So my volume 1 is actually the second half of my book. My volume 2 is the first part of my book, and it's alphabetical. So with my alphabetical, that's where I started using my alphabet letters to start tapping the different sections. The terms and the code numbers that you see in the alphabetic index, you will confirm in volume 1 in your tabular. So when I say to you, let's just look at, the first thing that appears in A, abdomen. If we look at abdomen, it also says abdomen, abdominal. And then it says, see also condition. But underneath it says accordion, acute, angina, burst, convulsive equivalent, heart, muscle deficiency syndrome, and obstetric. Okay? If our exercise had any one of those on it, we would look at the code. Let's just say, for instance, acute 789.0. We already know by the red that it needs a fourth or fifth digit. We do not want to code directly from our alphabetic index. We want to go back to our tabular to confirm that is the correct code to use. So if we look at 789.0 in our tabular, let's take a moment to do that. Look at 789.0. All right, I have page 945 in my book. What do you have, Evelyn? 789.0, abdominal pain acute. Find it? 789.0.
I found, oh, right there, abdominal.
What page?
It's 650.
So 651 in the gray book and 945 in the spiral bound book. So you'll see 789, it's either in red or has a red dot next to it. So you want to code to the highest level of specificity. So you should see something that says other symptoms involving abdomen and pelvis. The following fifth digit subclassification is to be used for codes 789.0, 789.3, 789.4, and 789.6. Then you might have a gray box or a box or something that shows you 0 through 9. And then in it, it gives you unspecified site, right upper quadrant, left upper quadrant, so on and so forth. Those are your subclassification codes, okay? That is your fifth digit, your fifth character. Then you might have something that says excludes symptoms referable to genital organs. Then it goes on to show you 789.0 is abdominal pain. And then underneath it has brackets. And in those brackets, it has 0-7, 9. So what that is telling you is that you're going to use 789.0, but then you're going to have a fifth digit from the subclassification up above, because you want to indicate that it is right upper quadrant. So you would end up coding it as 789.01. Okay? If it was unspecified, you would put 789.00. Okay? Where it says coding clinic or something along those lines, coding or CCI, you don't have to worry about those particular things in the book. Okay, so when you're coding, you want to code as close to the verbiage, if not exact verbiage, from the exercise. And we will get into that more as we go into the book. But just so right now you're aware, chapter, section, category, subcategory, and then what are your third, fourth, and fifth digits. You cannot code strictly from the alphabetic index. You have to go into your tabular and confirm. And then we have tables. I mentioned earlier tables in the book. Hypertension table, neoplasm table. Take a moment to locate your hypertension table in your ICD-9 book. And again, these are things you might want to tap. So if you have, a sticky note to put there for right now in your head, or just make yourself a note to tab the tables. Hypertension is one of them. Neoplasm is the other one. Drugs and chemicals, and then the E-code index. And you'll see with the hypertension table, it's either malignant, benign, or unspecified. And as we get into the other tables, we'll be able to talk about the different sections in there as well. Did you locate yours okay? No. Hypertension should fall under 8. Neoplasm will fall under N. Your drugs and chemicals actually fall under T for table of drugs and chemicals. And then your E-code index will be at the end of volume 2. Did everyone find those? Oh yes, those simple tags that you have with you are perfect for you to mark where. Oh, where's the other one? Right, so that would start your hypertension table. Yep, and then neoplasms gonna fall right under N. So here's your neoplasm.
Okay.
Then table of drugs and chemicals should be right here, drugs and chemicals. And then after that, you should have the E-codes. E-codes, right? Did you find yours, Angel?
Yeah. Working on it.
Okay. So those will be ones that you'll want to have later. As I mentioned earlier, volume is about procedures. It is not used for physician services. It is used for inpatient services. And you will notice in the procedure section that it have a maximum of 4 digits, usually 2 preceding and 2 after the decimal. So we're going to jump back to our tabular list just for a moment, and we're going to talk about the 2 major divisions. The 2 major divisions that you're going to see in the tabular list, the first one being the classification of diseases and injury. That starts you right off at the beginning with the 001.0 through 999.9. That is your biggest division, the biggest section. You have the supplementary classification that I mentioned earlier, your B codes and your E codes, and those will be near the end. Your B codes, what you will find in the alphabetic index to start, but the E codes have their very own index at the end of the drugs and chemicals. So your E codes, when you look up, they will be in their own alphabetical index. So what are your V codes? Your V codes, let's go ahead and find the V codes in your ICD-9 book. I have page 1008. Yeah,
B code.
V codes.
B code.
So 751 in the gray ICD-9 book and 1008 in the spiral bound. Your V codes are V01.0 to V91.9. This is where the patient is not ill, but they are encountering the health care system. It could be for vaccination. It could be a patient presenting for treatment, such as chemotherapy. Some of your V codes are primary only, such as an example would be encounter for chemotherapy, V58.11. Some of your V codes actually factor that influence of the patient's health status, such as a personal history of a malignant tumor or an organ transplant. It might also be that of a birth status and outcome of delivery, V7 and a V33. The classification of diseases and injuries, again, is the main portion of your ICD-9 book. And the codes start with 001.0 and end with 999.9. Most of your chapters are going to be organ systems. You'll have the digestive system, the respiratory system. There are 17 chapters. A section tells you that it's a group of related conditions. So as I mentioned earlier, chapter 1 is infectious and parasitic diseases. And then what is the section? The section is all about intestinal infectious diseases. So all the codes under that section is related to that specific section. We went over the format already. Section, chapter, section, category, subcategory. Just remember, each thing tells a story, all right? It tells the payer why we are seeing the patient. Always remember to assign the highest level possible based on documentation. So if there is a 4-digit code that exists, you're not going to report the 3-digit code. If there is a 5-digit code that exists, you are not going to report the 4th-digit code. We kind of briefly mentioned the appendices in volume 1. There are actually 5. Some of your private publishers might actually have more. You have Appendix A, I think, through L or M. If you look at your table of contents, it will show you what they are. Appendix A is the morphology of neoplasms. On page 209 in your textbook. And one thing I forgot to mention in your textbook, if you haven't started doing it already, is to do the in-chapter exercises and do the quick checks. Okay?
So you want to do the quick checks? I was doing the exercises and I did the quick checks for the first one. I wasn't sure.
Put it this way, you don't have to do them, but it is a benefit for you to do them as you're reading because it kind of helps you determine, did I really get what I just read or did it go over my head? Okay? And then you can ask about it when you come to class too. If there was one that just really stumped you, And the quick check answers are at the end of your chapter. And I think the exercises within are at the back of the book. So the only answers you don't have in the back of your book are your theory and practical, which are the ones at the end of each chapter. And those are what we will go over in class. I usually don't have you do the theory and practical until after class, but we'll see how it goes. So your quick checks, also your coding shots. When it gives you coding shots, it's giving you a little tidbit of information. As well as when it says, check this out. You might see a little hand that says, check this out, okay? Take a moment and just do what it says, check this out. If you have a caution box, read the caution box. So, the Appendix A, Morphology of Neoplasms, again, it's used in conjunction with codes from Chapter 2, which is neoplasms. It is used in the inpatient setting. It is used for your cancer registries and claim forms. Your M codes are not normally placed on a billing claim form. They're used internally. Your morphology codes start with an M and then they're followed by 5 digits. The first 4 digits are usually the histological type of the neoplasm. And then the 5th digit is the behavior. So it might be benign or malignant or unspecified. So if you turn to Appendix B, guess what? It was deleted in 2004. Most of your psychiatric disorders are now classified using the Diagnostic and Statistical Manual of Mental Disorders. We're on page 210 in your textbook. Appendix C, this is your drugs. The drugs are in alphabetical order and all of the codes are up to 6 digits. The appendix is going to be used primarily by pharmacists to track drugs nationally. The AHFS listing is correlated to the ICD-9-CM table of drugs and chemicals. The new drugs that are not identified by name, they may rather be listed under the heading of drug in the table of drugs and chemicals. So if you were to look up antibiotics, you might find it with 8404-04. We don't do a lot of drug stuff. Appendix D is industrial accidents. These are not assigned by coders. These are 3-digit codes that actually identify occupational hazards. And these are not placed on insurance or billing forms either. You'll see that these are used more by your state and federal organizations, such as OSHA. And who knows what OSHA is? Occupational Safety Hazard Administration. Appendix E are your 3-digit categories. This is presented by chapter. Your categories are labeled 1 through 17. And they, again, are followed by the V and E codes. They will provide a quick overview of your ICD contents. Moving on to Volume 2. In Volume 2, we have sections. The first section is the Index to Diseases. So Volume 2, you will see, starts off with letter A. Then within Volume 2, you have the table of drugs and chemicals. And then Section 3 of Volume 2 is the E codes, the Index to External Causes of Injuries and Poisonings. Your E codes will never be a primary diagnosis. Medicare does not accept them for professional billing. So in Section 1, your index to diseases, as I mentioned earlier, is going to be the largest part of volume 2. So your first step in coding is always going to be to locate the main bold term in the index. Now, in your index, Emily, is it all black, or does the black, is the word in bold?
Bold.
Okay. So in mine, it's in red. And then the additional text is in black. So that is how it would stick out for me. Once you find the main term, you would have some subterms that are indented, usually 2 spaces to the right. You might actually have more than one subterm. Okay, so you would just have to read down below. So when you're coding and you're looking in your alphabetic index for something, this truly is where your terminology and your A&P start coming into play. And what I would suggest to you is, as you're looking at words in your alphabetic index and you need another reference next to that term, don't be afraid to write it. And I'll give you examples as we highlight and go along. But if you see something in here next to abdominal pain and there's some type of sign or symptom that goes along with abdominal pain that you want to remember, write it right next to abdominal pain. So that next time you look up abdominal pain, you'll see it and it will trigger a memory of something. Okay? Utilize your books. Use white space. Use the blank space to make notes for yourself. Okay? We went over 3-digit codes are your category codes, 4 digits subcategory, and 5 digits are the subclassification. I can't stress enough that you do not code from the alphabetic index. You might actually see some words that are do not appear in the tabular, and it's just to save space. So you will very, 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 very rarely code from the alphabetic index. As I just said, you don't want to code from it, but there are those exceptions where they didn't put something in the tabular for you to reference, to confirm, just because they're saving space. So if you find a word that's in the alphabetic index, you want to try and find the exact wording in the tabular as much as possible. What can I give you for an example? Staphylococcal. What's staphylococcal? It's an infection. So you would have to know that staphylococcal is an infection. If you didn't find it under staphylococcal, you would look under infection. As I just mentioned, this is where your term A and P come in to play now. Okay? So knowing the A and P, knowing the terminology, prefixes, the suffixes, the combining forms, all of that. All right? Now let's look at the table of drugs and chemicals. I have page, I think it's 523, table of drugs and chemicals. What do you have, Emily?
The table of drugs and chemicals.
What page?
1,681.
1,681 in the grade book. In my spiral bound book, it's 523, right, Lisa?
Yeah.
Very good. All right, so you'll see that the drugs are named alphabetically on the left underneath substance. And then you see across the top, the first column is poisoning. You would code for the substance involved, meaning that the wrong substance was given or taken. So right up beside poisoning, you can write it sideways along the side of poisoning. You might want to make yourself a note that this is a wrong substance given or taken. So just next to poisoning, wrong substance given or taken. And that's how I would just write it in the book, just up beside poisoning, underneath it, on top, like on top of it. Okay. So then the next thing is sorry. Also, poisoning could be accidental. It could also be therapeutic use. It could be suicide attempt or an assault or undetermined. Your E-codes will identify how the poisoning occurred. So if an analgesic poisoning occurred by accident, you would use an E-code. So the correct order for poisoning, there would be 3 codes required. You would identify the agent, then you would do the condition, and then the accidental poisoning. So let's say someone was accidentally poisoned, it was occurred by accident, so agent is analgesic. What's the condition? They came in a coma, and then the accidental poisoning would be the E code 850. So a poisoning order of coding, you would have the agent, identify the agent, what's the condition that they presented it, and what was the accident? It was accidental poison, so an E code. So if it was a poisoning, identify the agent first, then identify the condition, and then that it was an accidental, so it would be an E code. We will go over these again. If we had an adverse effect would have 2 codes required. We would have the condition and the therapeutic. The adverse effect happened because, why? Give me an example.
Allergic?
Could be, yep, absolutely. So,
Too much of a medication.
Yep. Adverse effect could be like me sometimes. I forget. Did I take it? Look at my watch. I think I took it. I'm not sure. No. Err on the side of caution and just don't take it. There's 2 codes required for adverse effect. You would code the condition first. So if someone ended up in a coma, that would be the condition. And then the fact that it was therapeutic. It was therapeutic because they did something incorrectly. They took it incorrectly. That would be the next code. So you would code the condition and then the therapeutic, which is an E code. If it was an accident, it was unintentional. So next to accident, write unintentional. Accident, unintentional. With accident, it could be therapeutic. Accident could be, as I mentioned earlier, forgetfulness. Accident could be, you know, if someone gave you the wrong thing. What else can you think of?
Put too many in one day planner.
Yes, too many in those little pill boxes.
Yeah.
They all look the same after a while, don't they? All right, therapeutic poisoning. Therapeutic poisoning is where the correct dosage is correctly administered, but there's adverse effects, like you mentioned, Angel, allergic reaction. So therapeutic would be a type of allergic reaction. So next to therapeutic, allergic reaction. Then we have suicide attempt, right? A suicide attempt needs to be documented. Suicide attempt needs to be documented.
That's okay. You have to buy my thing.
And then an assault is intentional by someone else. An assault is intentional by someone else. And then undetermined is basically unknown. Undetermined is unknown. We don't know what happened. We don't know why they were going to do it. Okay? So far, so good. Any questions? Okay. E-codes. Codes are a supplementary classification of the external causes of injury and poisoning.
Where are you? What page are you on? I lost that. Convention.
All right, turn to page 214 in your text and just drop your stuff and listen. E-codes, we've already mentioned, are in your ICD-9 book. You have an E-code index, and you should have white space in your book. All right? I won't be able to say this enough either. If you have white space in your book, use it to make notes, okay? Your E-codes are supplementary classification of external causes of injury and poisoning. Your E-code index in your ICD-9 book will show you alphanumerical designations for injuries and poisonings. Then what you do is you go into the E-code tabular and look up and confirm that that E-code is the correct E-code to use. Your E-code provides additional information about the external causes. It is never a principal diagnosis for an inpatient. and you have a separate E-code index in your ICD-9 book. So if you haven't tabbed it, it would be something, I make a note that you would tab later on. Tab your E-code index as well as your E-code tabular. Again, these will be alphabetically listed, okay? There will be a separate index. You will find the terms the same way you find them for the alphabetical listings. The main term is bold. You will have subterms. You will have them indented. You will have the same thing that, you know, they might be in the index, but they might not be in the tabular. The neoplasm table, volume 2 has your neoplasm table. If you turn to your neoplasm table in your ICD-9 book, neoplasms are tumors. Neoplasms are tumors. And they are located in the index under the alphabetic entry N for neoplasm. Do not reference the neoplasm table when the diagnostic statement states mass. Do not go to the neoplasm table when the diagnostic statement states mass. Instead, you would go to the site. So our main terms will be in bold typeface. You have subterms that are indented 2 spaces to the right, and these will not be bold. So if you were to turn to pain, pain would be in bold. And underneath it, you might see orbital region, 379.91. So take a moment in your alphabetic index and look up the word pain. Under P, pain. Take a moment and look up pain. Okay, so underneath pain, what do you have, Lisa?
Abdominal, acute, adnexia. Sorry.
Okay, so then what it does, if you from listening to Lisa, what it does and looking in your book, it starts out alphabetically listing all the different areas or types of pain. So what you would do is you would read down through that list to find the pain you're looking for. You don't find pain and stop there, because you need to know, is it mouth pain? Is it knee pain? Is it hip pain? Is it toe pain? Is it eye pain? Ear pain? It might say C condition, and you might have to go to earache, okay? Or it might go to, what's another word for ear? You would go see an ear, nose, and throat, so it might be, you get where I'm going with this. You would have to know what the,
It says here, otologia.
yes, otolaryngeal. Otolaryngea, something like that.
My
Okay,
Latin stinks.
Yes, thank you for looking that up. So otolaryngologist, that's what it is. Ear, nose, and throat person. So otolaryngologist, otolaryngology, otolaryngologist, otolaryngology, yeah. All right. In your alphabetic index, You will also find you have non-essential modifiers. What are your non-essential modifiers? They are enclosed in parentheses. So these are things that do not have to be in the diagnostic statement, but it might be helpful for you when you're trying to find the correct code. They don't really have an effect on the code selection. They just give you a little bit more clarification. So if you were to go to Ilias in your alphabetic index, you might see something in parentheses that says dynamic and then in parentheses vowel. Okay? It's just basically giving you a little bit more information about the Ilias. Our conventions, ICD-9 conventions on page 214 in your textbook. And then if you have your alphabetic, if you look at your conventions in your ICD-9 book, on my book, it starts with, in the beginning, guidelines, and it says symbols and conventions. And it goes through the different sections. It shows you what the symbols and conventions are. I would suggest you take a moment, read your ICD-9 the same way you read your textbook. When you're in your textbook, it gives you, believe it or not, guideline sections. So right there on page 214, it says, ICD-9 official guideline for coding and reporting. And it's a little white box. It says abbreviations, index abbreviations, and tabular abbreviations. Well, guess what? If you go over to section 1A in your guidelines, all right, page 3, Lisa, what is yours? Page 14. It says ICD-9 guidelines for coding and reporting, section 1, conventions, general coding guidelines, and chapter-specific guidelines, right?
Right.
And then A is conventions for ICD-9-CM. So then section 2 is abbreviations. So if we go to section 1, I'm on page 5, Lisa. Go to section 1, Emily. We'll say section 1. And it will say conventions, guidelines, and chapter-specific guidelines. Underneath it will say A, conventions. For 14, it might be 16.
I have conventions used in the tabular list
There.
in other conventions on page 9.
Okay, page 14. Page 9 probably is the content, the table of content to lead you to this section. Okay, so page 9 in the gray.
13 is.
Okay, yeah, and page 14 has conventions for the ICD-9-CM.
Yeah.
That's 9.
Okay,
13 is for
okay. So 13 starts the guidelines, and then 14 on the next page is where we jump right into the conventions for ICD-9. And that's in the gray ICD-9 book, and then in the spiral book, it's on page 5. So you're going to see abbreviations, you're going to see index abbreviations, you're going to see tabular abbreviations, you're going to see punctuation, you're going to see brackets, you're going to see parentheses. They're going to be italicized in bold type. You will see symbols, okay? So I want you to follow along in your guidelines right now, okay? Then you will have abbreviations that are NEC and NOS. You will also have notations such as includes, excludes, use additional code, and with, code if applicable, So far, so good? Okay. Your includes and excludes. We'll get to that in a second. Your NEC is not elsewhere classifiable underneath tabular abbreviations. NEC is not elsewhere classifiable, which means no more specific code exists. NOS, not otherwise specified. This means that it is unspecified in the documentation. So the patient came in with hip pain. It was not specified right or left. Okay? Brackets. If we use brackets, brackets usually will enclose synonyms or alternative wording or explanatory phrases. You will see brackets are used to identify manifestation codes. So they give you helpful additional information. They can affect the code, and you will find that these are only found in the tabular listing. Okay, if you turn the page or not, what I want to talk to you about now is etiology and manifestation of disease. The etiology and manifestation of disease, your etiology is what? It is the cause of the disease. The manifestation is the symptom. So for certain conditions, it is important to record both the etiology and the manifestation. When you see the etiology and the manifestation, you're going to end up with what is called a combination code. Okay? And if you look, a moment. Right. Okay. A combination code, an example of a combination code would be cystitis. And underneath cystitis, you would have gonococcal. Because cystitis is the manifestation. What is itis?
Inflammation of.
So gonococcal would be the etiology, the disease. Your slanted brackets. Your slanted brackets, they enclose the manifestations of the underlying condition. So what you might see is code first, underlying condition. These would be used in the alphabetic index in volume 2. It's getting chilly in here. Multiple coding. Multiple coding.
Which page are you on in the?
In the textbook, you should be it's not showing it in the textbook.
In the guidelines, it's not showing the slanted brackets as part of the conventions.
Yeah, it might be in one book and not the other. Emily's saying she has it in her book, but I'm not
It's
seeing it
in-
in ours either.
Oh, I meant the textbook. It's in on 217.
Okay.
The sling.
So it's in the textbook, not in the guidelines.
Yeah, I don't see it in mine either.
Okay. So just make a note. Sorry. Multiple coding, this is usually when there's no combination code. You would use an individual code in the following order. You would have the etiology first, and then you would have the manifestation second. So we'll get into more combination coding, multiple coding and stuff as well. Parentheses, these contain your non-essential modifiers. You can take them or leave them. The information in those are descriptive terms. You will see them a lot in your tabular list and your index. They will not affect your code selection. They are just additional information. Your colon in your brace, your colon in the tabular list completes a statement with one or more modifiers. Your brace in the tabular list modifies the statement to the right of the brace. Italicized and bold type. In just one moment. Your italicized will be all of your excluded notes. These are going to be the codes that you don't use as principal diagnosis. So in your book, Emily, it might say excludes. And then even in the spiral bound book, it should say excludes as well. You'll have stuff in bold, and these will be the codes and the titles of your list. If you have a lozenge and a section mark, your lozenge will indicate the codes that are unique to ICD-9. And the section mark are those two S's overlapping. That will be a footnote indicator. If you look at before your table of contents where it talks about conventions and symbols, you'll see a lot of this stuff. Now let's talk about your includes and your excludes. Your includes on page 219 in your textbook, and your includes, excludes on page 5 in your guidelines and the spiral brown. What page in yours, Emily?
That's what I'm having a hard time finding an inclusion.
It might be in the front of the conventions, like page 9.
Oh, no, right here.
What page?
15.
Page 15.
It's right at this one.
Okay, so includes and excludes. Your include will be in the chapter, section, or category. Your exclude notes will be the conditions that are coded elsewhere. And the use additional code of another code is necessary. Your and with. Your and with. And means and or. So an example of this would be 237.0. Neoplasm of uncertain behavior of pituitary gland and or craniopharyngeal duct. And or. With means one condition with in addition to another condition. With means one condition with in addition to another condition. So acute hepatitis C with hepatic coma. That's what with means. One condition with another condition. Your cross references directs you to C also, or C category. Your cross references would be C also, C category. C will direct you to a specific term. So painotitis says C otitis media. C also directs you to another term for more information. Perivaginitis, in parentheses, C also vaginitis. Your C category in volume 1, tabular list, specific information about the use of the code. So mesencephalitis, in parentheses, C also encephalitis, late effect, C category 326. So you have to read everything before, middle, and end, okay? Don't stop just because it looks like it's the right code. All right, code if applicable. Any causal condition first. So code if applicable, any causal condition first. Code if applicable, any causal condition first may be a primary diagnosis if there's no causal condition applicable or known or documented. You would see it as an instructional note in the tabular list. You would define the principal diagnosis. This would be used in an inpatient setting to identify the reason for admission. So if we had ulcer of a lower limb except decubitus, that would state chronic venous hypertension with ulcer, you would code it. If it's an ulcer caused by chronic venous hypertension, you would first code the hypertension and then the ulcer. Okay? Volume 2 with your notes. These define the terms. You would give further coding instructions. So if you looked in the index under melanoma, you might see a note that says, except where otherwise indicated. So on page 228 in your textbook. You're going to see that certain main terms are followed by notes. And it just basically gives you further coding instructions. So note, except where otherwise indicated. It gives you an example right there on page 229. you would see that there are mandatory fifth digits that also appear in the notes. So again, another reason never to code from the index. What you also will find in volume 2 are eponyms, where a disease or syndrome is named after a person. So Arnold Chiari, also see spina bifida, Sturge-Weber, Prader-Willi. Those are all named after a person. So you would look for them in the index just that way. Procedures, I told you that's volume 3. Those are used for inpatient settings. It gives you a little review of the format, how you would find them in volume 3. It lists the table of contents for you and how to go into the tabular and verify what they are. Again, this is all for inpatient setting. All right, how did everyone do with chapter 8?
I think I,
Lisa, you look lost.
No, I'm sick.
Okay.
No, I
Yeah.
really like this chapter.
Good. So just to close with chapter 8, opening and closing of a surgical site is included in all procedures. Opening and closing of a surgical site is included in all surgical procedures. Do not unbundle it and code it separately, because that is considered unbundling. Okay? If a closure takes place during a separate surgical procedure, then your closure may be reported separately. Your index will also contain omit code that directs the service not to be reported. So if we had a craniotomy as an operative approach, it would tell you to omit that code. You could not report the craniotomy separately. And we will get into all of these things later on. So much fun. Did everyone do chapter review and practical or just read?
Just read.
yeah, I just read it.
Okay, that's fine. So now hopefully that we went over it. It makes a little bit more sense. How about you, Angel? Did it help?
Yeah, your explanation was a little better than what the reading was. It kind of.
Okay, good.
Yeah, you had me until the end. I started to get a little
This-
lost and up and
Right.
down.
Good.
Understand it.
And the stairway helped pretty good too to put it together, how to break down and how you add in more codes and to go to the next step and understand it better.
Good. Okay. All right, why don't we take a quick 5-minute break, get up, stretch, and come back and we'll do an overview of chapter 2.
Well, are there going
No, we're all out. Wow. And then we didn't get punished because of the vacation. That's another thing. Okay, let me see. April 6th, that one goes up. So yeah, you got anything in April, I would say after the first week of April. Yep. So you're busy up to the 8th of April. And then we've got the week of the 13th open. The week of the 19th is, well, the 20th is a holiday week, or we have the 27th of April open. So it's either the week of the 13th or the 27th is open.
not bad.
Yep.
So what you'll have for homework is to do the review and practical and do chapter 8 in the workbook.
Chapter 2, we do the same thing for chapter 2.
No, chapter 2, I'll only have one that I really want you to be doing. So I'll need to add the bucket book onto Evolve for all of you. To be able to go on, take those exams.
So we just do 1, 2, 8, so 5.
Yeah, one, well, there won't be an actual chapter 2 exam on Evolve for you. I just want you to do, there's one thing in the book for chapter 2 that I want you to do.
Okay.
And that's all I usually have you do. Because chapter 2 really is a brief overview of ICD-10. So turn to page 27 in your buck book, and you can put your ICD-9 books away. Obviously, they're not going to help you.
What page?
27. So ICD-9 is going to be the basis for us learning ICD-10. And ICD-10, as we all know, was scheduled to replace ICD-9 actually this past October 2014. But that got delayed until October 1st of 2015. As I mentioned earlier, we are one of the last countries to be utilizing ICD-9. All of the others have been ahead of us and already using ICD-10 for a while, and there is talk of ICD-11. So what happens with ICD-10 is that we see a lot more improvements with relevant ambulatory and managed encounter codes, as well as an expanded injury code, and they have combination diagnosis and symptom codes, where we have 3 to 5 characters now in ICD-9, you actually have up to 7 characters in ICD-10. And it really is about level of specificity. And it definitely is getting, it is more specific. And that 7th character will actually describe the encounter. Is it acute? Is it subsequent? Or is it a sequela? And that basically means, did the patient come in an acute state? Is this a subsequent visit based on that acute condition? Or is this a sequela, meaning is this a late effect of something else that happened? You also will see updated diabetes codes and just a greater overall specificity in assigning these codes. The ICD-10 structure, you will actually see that there are 21 chapters instead of 17. And you will have 2 additional chapters, one for eye and adnexa, so turn to page 30, and ear and mastoid process. This is in your textbook. The GEM files over on page 31, your GEM files, they do not contain decimal points within the code. So for example, in the GEM file, I9 to I10, you'll see that there is, it's not A00.1, it's A0001. So we actually have the capability of mapping from I9 to I10 and then back from I10 to I9. If you look on page 32, they give you an example of I9 to I10 and I10 to I9. There are actually 3 types of flags, okay? On page 32, the first flag is the approximate flag. The approximate flag is a direct match from I-9 to I-10. So you will see the flag of 5 zeros, or six characters to 6 characters. Then you will see that there's a no map, meaning there's no diagnosis code available. And then there's a combination flag, which requires a combination of codes to map from one system to the other. And you'll see that over on page 33, they show you the I-9 to I-10 files. If you turn over to page 35, they show you the no mapping example. And then they talk about the combination flag, where the third character is the flag containing a 1. The same thing with ICD-10 in the index, page 37. You have main terms and subterms, just like you do in ICD-9. But if you look, the codes for ICD-10 in this example, they start with alpha characters. And as I mentioned, your chapters over on page 38, you have 21 chapters now in ICD. And if you look at each chapter starts with an alpha character. So we start with A00 and go through B99 for infectious and parasitic diseases. Our tabular is going to look very similar as well. Each section will begin with the unique letter and code arranged in numerical order. You will have official instructional notes. We have includes here, just like we did in the ICD-9 book. The includes actually gives you a definitive, or it gives you an example of category content. So turn the page to page 40. You'll see the includes. Then excludes 1. Now here's a little difference with ICD-10 versus ICD-9. There's an excludes 1 and an excludes 2 in ICD-10. The excludes 1 simply means that it's not coded here. You cannot code it here. It is pure excludes. It means not coded here. Your excludes 2 means that it's not included here. You might have to go to another code to code it. So excludes 1, you simply do not code it here, and excludes 2 means that it is not included here. Then we have code first and use additional code. Code first and use additional code basically is your etiology and your manifestation paired codes. You'll see the example figure 2-12. It gives you the code first, shows you over on the next page, 42. Then we have code also. Code also is very similar to ICD-9, where you might have more than one code that is required. As you can see by the example, it says code also the underlying disorder such as malignant neoplasm. Then over on page 43, we have the 7th character and placeholder X. So for codes that are less than 6 characters, they will have a 7th character requirement where X is the placeholder. So you see there the example that they give you other disorders of the patella or dislocation of sprain and joints. Okay, if you go over to the next page, they show you that X is the place. And that's it for ICD-10 now. Was that really bad? You might know what
That's
that
going to be fun to learn.
means. What?
That's going to be fun to learn.
Actually, it's a 5-week course that I teach after the ICD-9. If any of you take it afterwards, it's a 5-week course. It's much easier once we go through ICD-9. But this is not going to be on your exam, okay? What they are actually doing is that you sit and you take your ICD-9 first, and then what you do is you sit and you certify, you take a proficiency exam on ICD-10 after you do an ICD-10 course. And you can either take it through the academy, or once you become a member of the AAPC, you can sign up for one of their, online courses that you do on your own. But what I would like you to what I would like you to do for Chapter 2 assignment, if you turn to page 36.
Ugh, I started this one.
What?
I started it, but I come into complications when it started getting the letters. When I was looking it up online, I didn't know where to go from there.
Okay, so what you're going to do is exercise 2-2 on page 36. It tells you to access these GEM files, you need to go to your Evolve, go into your learning resources. Now you already have access to your Evolve, so basically you're going to go to course documents, just like it tells you, resources, student resources, coding updates, and GEM files. You're going to follow those directions just the way that it says, and you're going to try and do these exercises 1 through 17. And just give them a try. And you can check your answers at the back of the book if you want. It's just a little exercise. I forgot to take attendance. Give me just a moment. So we have Emily. Lisa Fry did not come on. I did not see Lisa.
No?
Say hello if you did. Barbara Hankey, she didn't come. Angel's here.
Yep.
No. And Lisa Leonard. All right. Okay, so for homework. So for homework, you're going to complete your theory and practical at the end of chapter 8. Yep, it's right at the end of chapter 8 in your textbook.
Is it the review, like the same thing?
Yeah, review and practical. It's right at the end. It's page 243 and 244. So basically, after the end of every chapter, you're going to be responsible for the review and practical.
Yeah.
And we will go over them in class, the next class. And in the workbook, I have you do the evens in the workbook, because if you do the odds are in the back of the book. And I go over those in class, the even numbers. All right? So for next week, I would like you to read chapter 9 and 10. Do all of the in-chapter exercises, quick checks. And I will make sure you're all added to Evolve Buck Book and you will do chapter 1, chapter 8 on Evolve for the exams. And there will not be a chapter 2 exam on Evolve. And I think it actually says, there is, but I don't have one, okay? What else? Oh, and chapter 2, do the exercise on page 36 that I on ICD-10. So we'll come back here
That
next.
last, could you repeat that last sentence? I didn't hear the last thing you mentioned.
Oh, page 36 in your textbook for chapter 2 is just that exercise to do the ICD-10.
Okay. Thank you.
Yep. So you still will need your ICD-9 book next week. We're going to get into doing some more highlighting and underlining. We're going to be talking about outpatient coding and reporting guidelines and how to use your ICD-9 book. So tonight we really just touched upon it a little bit. I would definitely recommend that you read any of the symbols and conventions, the beginning part of the book, the foreword, the introduction, table of contents. Get familiar with your coding books because these are going to be an extension of you for the next 4 months. Hard to believe we've already been through a month worth of class, but this will be, you're an extension of you. Tabbing, you don't have to go out and spend a lot of money on tabs. If any of you are interested in, these ones here, let me know and I can get some and send them to you. These are actually just $3 each. These are the numbers and the alphabet ones.
Should I bother with the alphabet and the number ones with the grade book because they're
Probably
already
not.
in there? That's what I was
Probably
wondering.
not. And then these are the Post-its. These are the Staples and the Averys. And these are the Post-its. You might like these.
Yeah, I like those,
more.
the ones that you put in my book.
Yeah.
I like those a lot better than what I have right now. Those are really fun.
But for you, because that's already notched out,
Yeah.
you might want to, as I ready, have the tab that already shows you where it is.
Yeah.
Because you can't see it from the side. When you're looking for the code right now, you can't really see, like right here. I can see all of this.
Yeah.
Whereas if you look at your book, you can't see anything. So, all right. So your takeaway from tonight, Lisa Leonard.
I think I'm gonna like coding.
Good. Excellent. Why?
Research. I read it in the book. It said something about a mystery. Who done it?
Yeah.
I like that.
Yeah. I do too. That's part of why I do what I do because it's all the research behind it. It's like, okay, how can I get this paid? You're telling me that you can't pay it, but why? Because your billing guidelines tell me that if I bill it this way, you'll pay it. So don't tell me that you're going to pay it and then turn around and not pay it. And obviously the representative on the phone is only going by a script, right? So you know that they're going to do what they're going to do. But there's nothing more satisfying than appealing a denied or rejected claim and then getting it paid. Yeah. What did I just come across? Oh, and then there's nothing more frustrating when you're given the wrong benefits for a patient and you thought they only had a $500 deductible and it turns out that now they have a $2,000 deductible and now they owe you over, $800 instead of just $500 because you were given the wrong benefits. Another situation I had last week was an Anthem plan that processed everything to patient responsibility. And it shouldn't have. So this is when you're a biller, this is where you understand and you know, okay, I verified benefits. So as you're posting in the electronic health records, you're posting the insurance payment, you see, okay, that's not what their benefits say. So I got on the phone the next day and come to find out they processed everything incorrectly. The patient had over $600 bill. They are reprocessing every data service for me, which means the patient will only have a $15 copay each visit. That's part of the job. So it's helping the patient, it's helping the doctor, it's getting the maximum reimbursement, it's those types of things. Because it's not all about, honestly, getting the door. It's like you said, it's a little puzzle, it's a little sleuth finding kind of thing. What's your takeaway, Emily?
Tonight was about the first night that I had to do. My head wasn't spinning the whole time. I felt like I understood most of it.
Good.
So it wasn't as overwhelming.
Good. Good. And how about you, Angel?
Reading everything from top, middle to bottom before you jump to conclusions.
Yes, yes. And I can't stress that enough. I know I didn't say it much in the Fordney book because we really didn't cover coding and that type of stuff in the Fordney book. But now that we're getting into the coding part, it really is important. Knowing that, oh goodness, some of the examples that you're going to come across, you know, as we start into these chapters, like in 9 and 10, there's going to be some stuff in some of the exercises, but I expect you to try and find the answer before you send me a message, okay? I am here for you to help you understand the exercises, and I want you to try and find the answer yourself before you come to me. And that's not to say I'm not going to help you, but as Lisa just said, it's about that finding that piece in the puzzle that fits. So, all right, if this is glossodinia, what does glossodinia mean, okay? Guess what? It's painful mouth, okay? Okay, glossodinia, okay, glossodinia, all right? And so, as I said earlier, this is where your term and your AMP are going to really start coming into play. So as you're reading the stuff, as you're looking up codes, and I'll try to pick some out. And I encourage all of you to pick them out as we're doing it and say, you know what, this is what I put for a note in my book. Because we're here to help each other. The notes that I have in my book are going to be helpful for you, but if you come up with something, share it. Because someone else might not think of that. And it's going to help later on when you sit for your national exam. You can put as many notes in your book as you need to. Basically, what they say is if it's something you would do for your job, you can have notes in your book. They don't want you to recreate a whole medical terminology book, but if it's something you would have normally put in your daily job, go ahead and make that note in your book, okay? So that's what we're here for. We're here to help each other, you know, with little tips and tricks that come up. You don't need to write whole paragraphs. You don't need to highlight every single word. It's going to be what sticks out for you. And as we highlight, I'll tell you, this is what I think you should highlight. This is what I think, you know, you need to stick out for you. Because this is a puzzle fitting type of work, okay? And it's not just about finding the codes, it's about knowing what the insurances are going to pay, did they process correctly, and recognizing that, and how to appeal, how to, sometimes they'll do it right over the phone. You call them and they will just fix it over the phone and reprocess it. So it can be fun. And I love what I do, otherwise I wouldn't be teaching it to you. People, my friends think I'm silly. They don't understand, but they don't like numbers the way I do. I told someone what I did one time and they said, Billy and Cody? I said, no, it's medical billing and coding. So now it is a joke among my friends and I about going to teach Billy and Cody. Okay, so that's it for this week. Thank you very much for your time tonight. I really appreciate it. Email me whatever questions you have. When you do though, please tell me what chapter you're on, what exercise you're doing, and if you're doing an exam, tell me what exam and what numbers you want me to look at, and I'll be happy to. Reminder, I do not get to emails that are requiring more than sending a lecture until the weekends. If you want me to look at an exam or answer something, it's gonna happen on the weekend. If you're just calling me or emailing me for a lecture link, that usually gets out in 24 hours. Okay? Have a great week.
I do have a quick question.
Sure.
The ICD-9 CM book, do we buy it ourselves or does your employer provide it for you, or is that something you look for in an employer?
That's something I would look for in an employer. If it's not something that they utilize, I would definitely say, you know, this would be great for me to have. It's definitely an investment. You can also use some sites online like Find a Code, ICD-9 Data, AAPC, once you become a member, has a section where you can actually go find a code. So there's definitely resources out there, and when that time comes, we can discuss them in more detail.
Okay.
Absolutely.
Okay, thank you.
Well,
I was just thinking ahead.
believe it or not, ICD-9 is an online book. I have it
Okay.
as an online book.
And ICD-10 will
But
be
probably
paper
doing the same
paper
thing.
form for a while.
Yeah.
Okay.
Yeah.
Thank you.
You're welcome. Angel, you all set?
Yeah.
Okay, so hopefully next week they'll have video.
Oh, I'm still here.
Okay. Have a great week.
Have a
Yeah.
good one.
Bye.